Hello, everyone. Thank you for joining us today. We have another 5 minutes until we get started. So go ahead and feel free to use the chat while we wait for our FSHD University to get started this month. Thank you. Hi, Ulrike.
Hello, I'm just getting clicked here and I just need to play quickly with my background.
Not a problem.
Let me have a look. Oh, share screen. How am I getting my background blurred? View. Oh, no. Can you just help me?
Yes, so I believe if you go over the video icon there, if you click the little arrow next to it, there should be an option that says blur my background.
Okay, 1 second. Oh, yes, I was
There
searching for that earlier.
we
Yes.
There we go, all set. And
Brilliant. Brilliant.
just to confirm, is it Ulrike? Is that how you pronounce it, or is there
It's
another?
Ulrike. Yes,
Ulrike.
that's completely correct. My family name is Uta, UTA, but I'm not too fussy about that, so no worries
Okay,
about that.
perfect.
Yes, so I've prepared a little bit of a talk, but I'm probably getting a lot more free-spirited because once I'm talking, I usually do rather than sticking to the script. But because we've got the question and answer, I think it won't matter.
That should be fine.
I hope I have a plan. No, I do have a plan.
It will be great. We're really excited for this presentation. I know June was extremely excited when we were able to confirm, and it seems like
Yeah,
participants are pretty excited for the topic.
yeah, yeah. And you are Barbara, is that correct?
No, I'm Ashley. I'm Ashley
Oh,
Pereira.
oh,
Yes.
hello, Ashley. Sorry about that.
No, not a problem. Not a
Lovely to
problem.
meet you.
Nice to meet you as well.
Good.
Perfect. It still looks like
And
we have.
yeah, cool. Yeah, fantastic. So I'm all set up. Have you got an idea how many people you're expecting?
Well, looks like, by the way, hello. Sorry, I just
Oh, hello, June.
popped in, but good to see you again. We already have 64 people in the room,
Oh my God.
and we had quite, and that's early. A lot of them will pop in right right after the hour. So I'm expecting a nice group, probably 75. We had over 100 register, so.
Oh my word.
Oh,
Maybe I
you're getting
shouldn't have
stage fright,
asked because that makes me rather scared now. God. Okay.
They're a very nice group.
Right. Okay. Yes, I'll just crack on. And you said, June, that you had some questions, or that you're moderating the questions.
Yes. So what will happen so that you can focus just on answering questions, there is a Zoom has an area. We'll ask people to post their questions there, and I will go through them. Some of them are, you know, are things that I can answer myself offline, just directly. Sometimes people ask questions that aren't exactly on topic, so we can handle those. And um, Ashley and I will look through and feed, we'll say the questions out loud, which also works better for the recording so people can later hear
Mm.
what the question is. Ashley, how would you like to do that? Actually, do you want to screen the questions and read them out? And or do you want me to do that?
If
So,
you want to go ahead and do that, that's fine, only because I have a little bit of noise here in the background.
okay.
I have some very excited parakeets, so apology in advance.
Oh, that's great. Well, I will let you do the introduction and get things going, and then maybe I'll jump in at the question time and I'll do the questions.
That's it. And I mean, if there are questions I can't answer or I don't know, then I'm quite happy to say so as well.
Yeah,
Okay.
sounds good.
Right.
Right.
Yeah, it looks like we are right on the hour. So we're going to go ahead and jump on in. Good afternoon, everyone. And on behalf of the FSHD Society, welcome to this month's FSHD University. Before we get started, a quick reminder that while we do encourage you to use the chat to interact with each other, please make sure that you use the Q&A section for any questions you would like to ask our presenter today. Also, please note that the session will be recorded and available on our YouTube channel within the next week or so, usually a little sooner, but we do ask for a little bit of grace there. We're really excited to have our presenter today. Please welcome physiotherapist Ulrike Uta of the Muscular Dystrophy Support Centre in Coventry, United Kingdom. Ulrike has extensive experience helping individuals with FSHD and has noted that muscle weakness from FSHD can cause people to compensate by overworking other muscles. In today's webinar, she will address how to make muscles that are overworking to work less hard and to get those that are underworking to work as well as they can, all within the frame of FSHD. We know that many of you were excited for this presentation. And so with that, I will let Ulrike take it away. Thank you.
Hi, hello everybody. Good evening. Well, good evening in the UK. So yes, as Ashley said, I'm a physiotherapist. I'm working with a charity in the UK, in Coventry, the Muscular Dystrophy Support Centre. And I'm working with adults only, but with a wide variety of age groups. So basically from 18 onwards into the 80s. Some of the service users I'm seeing have only been diagnosed. Some have had FSHD for a very, very long time and lived with it for a long time. So what I'd like to talk to you today about is my experience of working with people with FSHD. So when we see people, or when I see people for an initial assessment, I sometimes have people who say, I don't know why I was sent to you because there is nothing you can do about the FSHD. It's all genetic and I can't change it. And other people are saying, when I ask them about their goals and expectations, I want to stop FSHD from progressing and I want to keep on walking, and this is what I want to achieve. And things are things are always a lot more complicated. There are not very easy answers to either of them. So what I thought I'd like to do is talk very briefly about what physio can do and what physio can't do. And in order to achieve that, I'm going into a little bit about the pattern of the weakness, why it looks different for people, even so people have the same condition. Everybody presents differently. Talking about compensatory mechanisms, and then going into the physio side or exercise side. So you're all aware of the pattern of weakness. Focusing on the body, there is the weakness between the shoulder blades, the trapezius muscles, the rhomboid muscles leading to the winging scapula, the winging shoulder blades, the weakness at the front of the chest, weakness at the biceps and triceps of the arm, and the tummy muscles. There can be lots of other weaknesses as well, but those are often the main groups. And I think they're really good examples of especially the shoulder girdle and the core muscles to explain what's happening. So with the weakness slowly developing, everybody remains active and keeps on functioning, mobilizing, doing all the things of daily life. And our bodies find other ways of achieving that despite developing muscle weakness. And this is where compensatory muscle or compensations are coming in. So, for example, with the shoulder blades not being very well stabilized, the upper fiber trapezius muscles, the muscles which elevate the shoulders, and the muscles of the back of the neck extensors, are starting to overwork. With the tummy muscles not being as strong and wanting to be up against gravity, very often the shoulder girdle muscles are taking on the jobs of the postural muscles in order to keep bodies upright and up against gravity, and in order to be able to move about. And compensatory mechanisms are great because they keep us functioning and they keep us on our feet and working. But there are also a lot of problems, potential problems, which can arise out of that. So with the common compensatory mechanisms we are seeing, it is shoulder girdle, neck extensors, and very often the back extensors. They are starting to get quite tight and overactive. I said earlier that people with FSHD can present very differently. This is firstly because genetically, everybody is different and shows different variations. But from a physio point of view, it is as well that we all have very individual movement patterns, which we learn as children. And we all have different strengths and weaknesses, and things we are good at and things we are not as good at. And if those individual strengths and weaknesses then meet FSHD, for example, it also expresses differently and people compensate differently. People always compensate more with what they're good at. The problem with these compensations is that muscle groups which are not designed to do loads and loads of postural work are suddenly doing more of that, and they are getting overactive, can lead to strains, to pain, to tightness. Also, our joint position or the alignment of joints or the posture is changing. So if, for example, the upper fiber of the trapezius are working really hard, the shoulder girdle is elevated. The tummy muscles are weak and there's either a flopping forward or a leaning backwards, but then the shoulder girdle is coming in. So that changes the posture of the shoulder in itself, and the shoulder muscles, even the ones which are not effective, find it a lot harder to activate because the shoulder is not sitting in their normal position anymore. With the tummy muscles, for example, if the tummy starts protruding more and the tummy muscles are lengthened and the back muscles are really tight, then these tight back muscles can work like a handbrake to the tummy muscles. So firstly, because these tight back muscles can give more resistance to the tummy muscles, so the tummy muscles have, when they activate, have to work against the tightness of the back muscles. But there is also a different mechanism going on. When a muscle group is very tight, it tells the opposing muscles that they don't need to work because these tight muscles have it under control. And this is a pattern which can then lead to further weakness. And we see that particularly around the middle with the tight back muscles and the weak inactive tummy muscles, but also with the shoulder girdle. So if the shoulder girdle is really, the upper fiber traps are really tight, the muscles which actually pull the shoulder blades down towards the rib cage, which are weak with the FSHD anyway, they find it even harder to activate because these muscles at the top of the neck are constantly pulling the shoulders forwards and upwards. I hope that makes sense. If not, just ask me about it again. So basically compensatory mechanisms can be really useful because they can help us functioning, but they can also then hinder weak muscles to activate and lead to more inactivity and to more tightness, discomfort, pain, heaviness, that sense of there is so much resistance to work against. So, going back to what physio can do and what physio can't do. So that was basically setting the scene. What physio can't do is we can't change the genetics. We can't change muscle fibers which have altered and can't contract anymore. There is no exercise in the world which can get that back again. However, physio can, or exercises can, address problems with posture, with tightness, with stiffness, with overactivity, with underactivity. All these things where muscles have much more of a potential and they're not living up to their potential. So in my work, I'm usually talking about optimizing function and mobility. For some people, when they're coming, some people are already really, really fit, really active, very aware of their posture. And it might well be that they are already working very close to their optimum. However, many people are coming with a big bunch of compensatory mechanisms because when these develop slowly, they're just sneaking in. We are not aware of those. And everybody has some compensatory mechanisms going on in their body. And yes, because they're just developed over years, they're a habit. And we have often no clue that they are there. And we have also no clue how to work with them. So if we're thinking about primary effects of FSHD, the muscle weakness, which is caused because of genetic changes, we can't change that. But if we're thinking about secondary issues, we're standing a quite good chance to actually make some improvements. So, and what can physio do? So if you think about muscles which are overworking and are really shortened, firstly, they're not comfortable. But secondly, when muscles are really short and tight, they don't have much potential to actually contract even further. So they're losing their force because they're constantly holding on. Secondly, muscles which are very long and overstretched, for example, the tummy muscles in a protruding tummy, because they are lengthened, they find it really hard to contract purely because they're in a position where it is naturally for a muscle a lot harder to contract. Take in then the tightness and resistance of the opposing muscles, then they find that even harder. Because moving is getting more difficult, there is also that element of how much is somebody actually moving and doing. So there is that deconditioning, the use it or lose it business, which can be addressed. And I mentioned that before, this habitual pattern, that not being aware of in which posture we are, how we are moving, that unawareness really. I think this is something where working with a physio can be really, really useful, because physios can point out where actually changes are in the first place. So generally we know that exercises are great, and we all should. There's a lot of benefits to exercises, about flexibility, about strength, about fitness, about posture and body awareness, about health of heart and the respiratory system. I think there is really important is as well the mental health side, and that feeling of control and feeling in charge when we are exercising and moving. We know our body releases endorphins, which make us feel good. But even if we take the endorphins out, I think there is a lot of power and taking charge again if we are feeling that we can actually make differences and see that there are differences are possible. So yes, obviously I'm a bit big advertiser for exercises, but there are issues with it. When movement is difficult and fatigue is an issue, it can be very, very difficult to be motivated. And I think also when there is a lot of weakness and a lot of change to normal movement pattern, it's important to have help to analyze how movement is happening and to look at how somebody moves. So just following an exercise video is often not the best approach. Release of tension, I think, is tension in the muscle and in soft tissue, connective tissue, is a massive area. Even if tension doesn't cause pain, it always has the potential to cause pain. And I think that element of just not feeling great when we have areas of tightness and tension in our body. And then the big thing for me as a physio is activating muscles which are inactive, either because they're weak or because they're in a position where they find it really hard to work. So this is all about physio and exercises. But then the question is, which exercises and how much? And this is where we come into a really tricky area, because if we're looking at the evidence, if we look at the research, there is very, very little research available. And the small amount of research we have for people with FSHD or muscular dystrophy are often very, very small sample sizes. And as people are presenting with lots of different symptoms, it's not a very, the cohorts are often, just show a very wide presentation. So what follows out of that is that the research we have on exercises is usually inconclusive. Basically, we have a rough idea what we need to do, also because research is transferable from from other research with people, even though there are different conditions, we have a guidance about what the effect of exercises with long-term conditions. But basically, what we have on evidence is only very rough guidance, and that makes things a lot more tricky. There is a particular absence of research for high-level, strong, well-functioning people with FSHD. So people who are not as severely affected, and where we're looking at more high-level sport and more intense training. Basically, we don't have any research on that. So where does it leave us? It leaves us with that every person with FSHD needs to try to learn as much about their own body and how their body responds to exercises as possible, because at the end, you are the experts. Therapists can give you guidance, but at the end, you need to evaluate how exercises affect you, in what feels good and what doesn't feel good. Did it feel the right intensity? Or did it feel too much? Too little is usually not a problem, because that means just next time you can do more. But listen out for signs if it's too much, which would be problems like pain, which lasts for longer than 24 hours, fatigue, weakness, which lasts for longer than 24 hours. So it's okay to be tired after exercises, but you should feel that you're recovering within a reasonable time frame. And this is unfortunately where we're getting really, really vague with intensity. So what are we looking for? So the first thing I would say is looking at flexibility and release of tightness. What is tight can't work properly, and what is tight inhibits other muscle groups from working well. So we are looking at exercises which are more on the mobilizing side, nice big range of movement of joints, but also exercises such as yoga, or the big area of yoga where it goes on stretches and muscle release. Then the next area, I'm a physio, I would say the core, which is tummy muscle, because the core is all the middle is what gives us the stability to be up against gravity. And gravity works on us all the time, so we need to have that strength. The problem with the core is as well that often people can't feel their core. So awareness of the core, strengthening of the core. In the UK, lots of physios are Pilates trained, and so am I. So this would be my go-to area. But again, there were other approaches as well. Then awareness of posture. Trying to figure out with a personal trainer, a physiotherapist, what positions you are in, what joint positions you are in, and are you able to change them? And this is really interesting, because if you are in a position for a long time, your body will perceive those as normal. So coming into a normal position, which your health professional says this is where you should be, will feel really, really weird, because it's not what your body perceives, your brain perceives as normal. And then the big area is fitness, We want to be as fit as possible, and then this sort of coordination and balance work as well. So now the next question would be, so what would be the exercises? And that really depends on which level of activity or strength or mobility each individual is. So if you have questions for me about specific exercises over an online forum, very difficult to say, but I'm happy to give general guidance. So this is basically what I wanted to talk about, what physio can do and what it can't do. So going back to those people who are saying, well, you can't do anything because it's all genetic. Well, actually we can. We can optimize and help you to be as good as possible. Those people who say, I just want to stop FSHD progressing and I want to keep on walking, I might not be able, I'm not able to stop FSHD to progress. And we are always trying to keep people as mobile and as possible and as long on their feet as possible. But sometimes it's better to also be open to adaptation, because it's not just about battling on, but it's also about doing the things which are important to you in your life. And sometimes this is better to be done by using a walking aid or by using a wheelchair, because you then have the energy to do things which are really important to you, rather than worrying about falls. But that's a whole adaptation is a whole other, well, it's linked, but it's a whole big area, obviously, as well. And there might be question coming about that. So I'm quite happy and open to answer as well as I can. I hope you found that interesting and or helpful. And that's basically what I wanted to talk about, and happy to have questions to that.
Thank you so much. That's such great kind of an overview of how each individual needs to think about approaching understanding their body and their exercises and what can be done. So thank you so much for that. We have lots of questions. So if you have questions for Ulrike Uta, please put them in the Q&A area, and I will just jump right in. First question has to do with pain. They say muscle pain associated with FSHD. What is the role of physio in addressing pain?
Yeah. So pain can have a variety of reasons. The first thing I would look for is overactivity and tightness, especially if it is muscle pain. If we are talking about muscle pain, so you poke and this is tight and it hurts and the neck is tight, and the posture has changed, then this is something where I would look into muscle release and soft tissue release and realignment. Now, if we're talking about joint pain, so that is the really deep, pointy. So muscle pain and soft tissue pain is often the pain which is an area where, about looking into joint pain is often quite sharp, quite localized. And joint pain, for example, in the shoulder, can happen by instability of the shoulder because of the weakness. And then the supporting structures, the ligaments, are not stabilizing the shoulder enough. So the shoulder is quite notorious for pain because the shoulder doesn't have very much bony support. So the socket is quite shallow and the head of the humerus of the upper arm is just sitting in there. There's lots of movement possible, and that's why our arms are so mobile. But it means that just having the ligaments to hold on tight is not enough, and there is too much movement and too much malalignment, and the weakness pattern around the shoulder often makes the shoulder joint change position. If then coming additionally things like use of walking aids or pushing over the arm or pulling over the arm in transfers, then that can cause inflammation within the joint. And that is a medical issue. So that is not exercise anymore. So physio or exercises can address tightnesses, weaknesses, those type of causes for pain. But if we are actually looking at a strained and inflamed joint, then this needs to be tackled with medication to reduce the pain and probably some external stabilization to make the joint, to take the strain out of it. So there are certain things basically we can do about pain, but there are certain things where we need to be clearly about saying this is time for seeing an orthopedic consultant or doctor.
Thank you so much. There was another, well, you did address, I think, a bit about muscle tightness. People have wondered about massage to help loosen. And obviously there are many different types of massage. Do you have a view as to what kinds would be most beneficial for the situation that
So I would definitely recommend massage if we're looking at a lot of tightness and discomfort and pain because of tightness. And what type of massage? It needs to feel good. And it needs to, so probably not the sports typey massage. We're probably talking more the relaxation type massage, the more holistic, gentle way. But there are lots of different techniques, and I have no preference there. It needs to feel good. Just think about that when you're loosening an area up, and it's an area which is actually needed to be quite tight in order to help you stabilize, then that area will tighten up again. So this is where I think that exercises are coming in as well to help you stabilize the body and activate the muscles as well as possible after they're loosened up, after tight areas have been loosened up. But in terms of this discomfort and pain, yes, go for massage. Definitely.
Here, a very common concern is around over-exercising. People are warned with muscular dystrophy to not go so far that you are damaging muscle and can't repair. So how do they tell where that line is, not the cross?
And that is so tricky. The opinions on over-exercising have changed enormously over the past 30 years. So 30 years ago, the advice often was, don't exercise, and because we want to preserve muscle tissue. That advice has changed. So there is a lot of benefit on exercising in the sense of cardiac and respiratory health and general fitness. Over-exercising is very individual. So if you talk about somebody who has been exercising all their life, they probably have a very good idea of how far they can push it, because they know how the body responds when you have done too much. You're aching, you feel weaker afterwards. In extreme cases, the urine can change color. So that's not what we want. So it gets really, really dark, basically, when tissue breaks down. But for a person who hasn't exercised much in recent years, to start off, we definitely say very little to begin with. And always check how you're feeling with it. So if we're thinking about somebody without FSHD, they would on a weekly basis increase their intensity level. With somebody with FSHD, I would say do it slowly. Stay 2-3 weeks on the same level before you increase. Generally increase more the repetitions rather than resistance. So don't use lots of resistance if you're working with machines. Don't don't overwork just one muscle group. Have a look at working more the whole body, for example, like exercises like Pilates, Tai Chi, where you have a variation of muscle groups. If somebody hasn't been exercising for a long time, they can be getting super tired when they have exercised. This is not what I would call over-exercising, but just somebody who's very, very unfit. So there are lots of different levels to it. Basically, start little, see how your body feels. It's not a problem if you have done too much. You should always get out of a session, pat your shoulder and think, yeah, I've done well. And that encourages you to do more. Don't exercise until you're exhausted. Especially in the gym, and don't use lots of resistance.
Great.
Sorry, that was a really long answer.
No, but that's really good. Thank you. Another very common question people ask is they worry that if they start using some kind of supportive and assistive device, or abdominal belt or braces or anything, that it will accelerate the weakening of their muscles, that they're not using their muscles enough now, and that they will get weaker faster if they use these devices. How do you navigate that concern?
Okay. So if we're talking about things like abdominal belts, shoulder braces, neck braces, these sort of things, they can be really useful to give the body external support and just give the muscles a little bit of a break and of a rest. So, for example, if we're going for that shoulder pain person, there is no brace in the world which is just brilliant. They will have advantages and disadvantages, and therefore I would say don't wear them all the time, but wear them for short periods of time to give your body a little bit of support and rest, and then take them off. The same with the abdominal belt. If that's used for reducing pain, that's absolutely fair. Or if you know that you have a strenuous day, use them for support and then take them back off again. And they're not detrimental for fitness. The whole walking aid issue is a really tricky one, because that's where we're going into scooters and wheelchairs, because with the walking and mobility is a huge emotional side to it. So often people use that as a goal to say, I want to work really hard so that I don't need to use a walking stick or a rollator or a wheelchair. And that's thinking, that sort of goal setting can get a life in its own. That even so, people are falling regularly. They are refusing to use a wheelchair because it's something they have been having in their head for many years, that this is not what I want to do. As physios, as a physio, I would always look that somebody is safe. And as I mentioned very briefly earlier, it's not just about exercises, it's about quality of life. There are things in your life you want to do, and if you don't be able to do them, if you're not able to do them because you're afraid of being on your feet so long or afraid of falling, then I think this is something which is really sad, because we all should be able to go out and socialize and have a life. And I think sometimes it's necessary to step back and reevaluate that. But I think that this session is just not the right, well, it's much too big than to look into that. But adapting to changes, I think, and adapting at the right time is something which is really important. So I would definitely say use what you need to use in order to live the life you want to live.
That's wise advice. And I think that it's very important when you're setting goals. As you say, sometimes to step back, you might have a micro level goal, but you have to look at what's the bigger goal. It's really
But this is massive. This is so big. This is such a big thing. It's we have in a charity a whole peer support group about adapting to change. And I think the tricky thing with a long-term condition or progressive condition is that you adapt to one thing and you think everything is settled, and then the next stuff is thrown at you. And I think a good support network and people you can talk to are absolutely essential. And sometimes you need people to point out the things you're refusing to see yourself.
Mhm. Well, I have a question here from a physical therapist. Question one, what do you think about strength training focused on hypertrophy? So muscles shrinking, really. Something like 6 to 8 repetitions of an exercise. Is that reasonable?
Now, I would always make that dependent on an individual. How has a person experienced exercising, and what effect has that on the person? I really have issues with prescribed exercise programs which are not based on the individual. So my advice to my colleague would be, if you're working with an individual and you feel that that person, your patient, is doing really well with something which is maybe unorthodox, but all your clinical signs and are telling you this is actually working really well, go with that. Use your clinical reasoning about what you're doing, why you're doing it, what is the effect, and what would be a detrimental effect. I think
Okay.
this is about as precise as I can be.
Yeah.
It's so tricky because this is the tricky thing for physios. We basically have no proper research to tell us what we're doing. We are basing the base of our knowledge is clinical reasoning, very often transferred knowledge from other areas where we have more knowledge, and then we have to base it on the individual.
Yeah. That's the challenge, isn't it? A second question from this physical therapist. Do you think that patients with FSHD recover more slowly from exercise compared to people without FSHD? And if so, what would be the reason for the slower recovery?
I think I see definitely more effects of fatigue, or that people are saying to me that they're tired for the rest of the day, but this is normal because that's always how they feel when they're doing something. I think the reason for that, there can be several reasons for it. I firstly think that in physio, where we are pushing people to move in a way they're not used to move. So even exercises which seem to us fairly mild are actually using somebody's system very differently, because we are asking for example, if we're just thinking about the slumping and straightening, so the rolling the pelvis forwards, backwards, the pelvic tilt, it's a very straightforward exercise. But if somebody is not used to activate and initiate the movements through the core, repetitions of the pelvic tilt can really challenge the way they are moving. And I think that this can wear people out very, very quickly. Then I think the general fitness level can be just not as good. I'm not sure if it is to do with the structure of the muscle itself. I guess, dear colleague, your guess is as good as mine. If we have less muscle fibers available to make a certain muscle to contract, then these muscle fibers will work harder, and that could lead to more fatigue. My way of dealing with it would be to just calculate that in and do less, or to advise. The better you know somebody, the easier it is to deal with it. Oh, I hope that wasn't a too...
Yeah. We have quite a few questions about the abdominal and core muscles. What types of exercises do you find are useful for your FSHD patients addressing core muscles? And then one specific individual said when her core muscles tighten up and force her to bend over, and what can be done about that?
Right. So which core muscle exercises obviously depends on how strong somebody is. So if you're weak, you will have to work in a very supported position where you don't work against gravity. So when I work with somebody quite weak, I would start with, as I mentioned before, with the pelvic tilt, rolling the pelvis forwards and backwards, seeing if we can get these core muscles going in the first place. If people find that easier, I would go into the Pilates style exercises, which are basically about making a connection between the pelvis and the rib cage. So the core muscles are sitting all around in that gap between pelvis and rib cage, and an active core can connect the pelvis to the thorax so that you have that really solid base. And then Pilates style exercises work with moving arms and legs whilst maintaining that stable base. If possible, I like to work as upright as possible because this is what is important for people, being on their feet and being up against gravity. But there is a big advantage of having more of a support. So lying on the floor or lying on the bed, because that means you can focus on your core activity and you don't have to worry about your posture or being up against gravity. So that would be the core. And then basically making the exercises appropriate, as difficult as possible. I like pushing people if it's possible. June, you said that question about the bending.
Yes.
Can you repeat that again?
That when her abdominal muscles tighten and force her to bend over so she
Yeah.
can't straighten up.
Okay. I probably would work not in an upright position then first, and work more either in side lying or more supported. But I think that probably would be good to work with a therapist to just have a look what's happening actually when the core muscles activate. Because at the end, we don't want the core muscles to flex the body. We want the core muscles to stabilize the body. We want to be stable and up against gravity. So the flexing is not really the function we are after. So I probably would say work with a therapist, with a physio, to see what is actually going on there.
Okay. You had mentioned Pilates a number of times. I was wondering if there's a question here about if there's a particular approach to exercise, such as Pilates, yoga, gyrotonics. I'm not quite sure what that is, but are there some that are maybe more relevant or better fit for FSHD in terms of the way they approach and analyze issues and work with them?
Again, I would say it depends on the level of somebody's activity and what they are able to do, and also on the instructor. I generally prefer to do work with lots of accuracy but take slightly easier exercises. Pilates is the way I am trained, but if somebody is able to work on yoga and on different poses, I would be absolutely happy with that. Similar with Tai Chi. Don't know what the other one was. Yeah. I mean, I personally would be quite open to all sorts of different approaches. Everything which focuses on awareness of posture, of alignment, of muscle activity, of breathing, of not overworking certain areas, of efficiency of movement, smoothness, coordination. I would say that's all.
Okay.
Okay.
Just one specific question about still going back to the core. Several people asked about rowing machines and sit-ups.
Again, this depends on the level of muscle strength and posture and alignment you're having. As there is, I can So if you're depending on your alignment, really. I think if you want to use a rowing machine, let a physio or a personal trainer have a see you how in which form you're doing it. What's your posture? What's your activation pattern? So it's not the rowing machine, but how you're doing it, which is the issue. If you're able to row in a good posture using the correct muscle groups, brilliant. If you're using the rowing machine and you're hanging in your upper fibers of the trapezius muscles and the neck muscles, probably not.
Okay, good. Here's a rather specific question. She says, I have tight hip muscles, the IT bands, and do you have suggestions for that? And she asks, will loosening the calf muscles help with that IT band tightness?
It can. I think this is a physio job. Again, it needs to be assessed what is going on. Is it only the IT band? Are the hip flexors tight as well? What's the state of the rest of the hip muscles? I would generally say very rarely that there is just one muscle which is tight. There is probably muscles are working in groups, and the different muscle groups need to work together as teams, and they need to be in balance with each other. So if there was one area which is tight, I would say, but apart from that, you're moving completely normal. Yes, do your IT band stretches. But if you feel there are more things going on in the posture is not textbook posture, and there are some other weaknesses and tightnesses, you need to see somebody who can analyze the movement and the posture and then work with you specifically. And yes, calf muscles can be an issue.
Great, thank you. We're almost near our time, and I have one from someone who says she is a fangirl of yours, maybe a patient who sees you. And you gave her great abdominal muscle exercises a year ago. And she says one thing is cardiovascular health and trying to maintain cardiovascular health when you're in a power chair. She said you had some arm pumping exercises, and are there other suggestions for getting your heart rate going when you're in a wheelchair?
Yeah. Now, getting the heart rate going, if there is a lot of weakness and potentially malalignment of joints as well, is a really tricky one. Generally, you can raise the heart rate really nicely with upper body exercises. I am a big fan of upper body hand exercises, hand bikes. If you don't have enough strength to hold there, you can often get attachments on the hand bikes where you can either strap the hands on like a Velcro glove, or where you have more forearm support. I would always say make sure that the bike is in a good height for you so that you're not straining the shoulders and that you're sitting in a supported position. So don't sit on a free floating chair, but prop yourself up so that the body is in the best possible supported position whilst you're exercising.
Right. Oh, I just want to fit. I know we're almost out of time, but there was one question from a postpartum mom. Any suggestions for her to, I guess it's a very broad question, but
Work with a therapist.
yeah.
Have to have a proper look at what's going on. It can be that through the pregnancy, you actually trained your body very well and you are actually surprisingly strong, because carrying 10 kilos extra is quite a lot of training. But I would say, again, it is very much dependent on posture and movement pattern. And I would say invest into seeing a physio to have a good look at it, go for specialized or specific exercises for you. But yes, exercise.
Yes. Thank you. And now, oh, I did notice, I think with a lot of Americans on the in the audience, physio is the same as physical therapy, right? It's just a little, yes.
Right, yeah. So I don't know how the Americans distinguish all that. So in the UK and in Europe, physiotherapy is a protected title in the sense of that this is, you need to have the training, you need to pass your exam, you need to be registered. However, there are lots of good sports therapists, trainers out there. I think be wary of somebody who tells you that they can train you up, without questions. If somebody says that, I always prefer people who say, well, we can work ourselves towards it and then see where we are getting to. And choose somebody who's good in analyzing posture and movement pattern.
Very good. Thank you so much. I hope you can see all the applause and hearts flying up from the audience. And now I'll turn it back over to Ashley to close us out. Thank you, Uta.
Okay. Yes, thank you so much, Ulrike Uta. This was an absolutely fabulous discussion, presentation session. Obviously, a lot of great comments and a lot of questions. So thank you everyone who joined us today. We really appreciate you really taking the step and taking ownership of your health and coming to these FSHD universities, asking questions to our wonderful presenters like Ulrike. We certainly hope that you will be able to join us for our next FSHD University, which will take place on Thursday, May 15th. We will be joined by Dr. Natalie Katz and Dr. Kati Devaye, who will present on the pediatric MOVE study, including an explanation of the design of the study, the impact that it will have, and answer any questions about how parents can enroll their children. I also encourage you to please visit our website events calendar for all of our upcoming chapter events, our wellness and education events. And again, thank you for joining us. We look forward to seeing you next month. And Ulrike, thank you. We really enjoyed having you here.
Thank you for inviting me. It was a pleasure.
Thank you. Have a wonderful day, everyone. Goodbye.